We are meeting today on March 27th, 2020, a day in history. One of the largest stimulus bills, actually the largest stimulus bill in the United States, was signed today, passed today by Congress, and will be signed later by President Trump. We are faculty in the Miami Herbert Business School. I'm Caroline Mortensen, an associate professor in health management and policy, joined by Dr. Emma Dean, Dr. Stephen Ullman, and Dr. Michael French. And we are going to walk through the stimulus bill that was just passed by Senate 2 days ago and by Congress today. So the bill, again, is the largest rescue package in the United States history at $2.2 trillion. It's being referred to as the CARES Act, or the Coronavirus Aid, Relief, and Economic Security Act. So it's a stimulus bill that just broadly, we'll discuss some of the specifics, includes additional funding for prevention, diagnosis, and treatment of COVID-19. It limits the liability for volunteer healthcare professionals. It prioritizes FDA review for certain drugs, emergency use of certain diagnostic tests that are not FDA approved. It expands insurance coverage for diagnostic testing. And it also has some major provisions for expanding telehealth, medical supply chain, nutrition, Medicare, Medicaid, suspends federal student loan payments for about 6 months, $500 billion to corporations, $350 billion to small businesses, over $150 billion to hospitals, health systems, and community health centers. A delay in disproportionate share reductions that were anticipated to have been occurring. I just want to note that this is the third bill that has been passed by Congress in the last several weeks. So just as a refresher, the first bill was a $3.4 billion bill called the Families First Coronavirus Response Act. Now that incorporated paid sick leave, some expansions of Supplemental Nutrition Assistance Program, more money into Women, Infant, and Children, or the WIC Act, paid for more access to school lunches. It required that Medicare private insurance must cover COVID-19 testing. So note at this point, it's just the testing and not broader treatment components in the earlier legislation. Required Medicaid also cover with no copay the testing for COVID-19, and also allowed states to expand their Medicaid funding to cover COVID testing for uninsured patients if the states chose to do so, with an increased federal matching assistance percentage at 100%. And in general, that bill increased the FMAP, or the matching assistance percentage, across the board for states. So that was the $3.4 billion act. Then just recently, the Coronavirus Preparedness and Response Supplemental Appropriations Act was passed at $8.5 billion with more aid to federal agencies like Health and Human Services and the Department of State. So the major $2.2 trillion stimulus bill we're going to discuss today, the CARES Act. We're going to start with Dr. Dean to go over some of the vaccine implications and some medical supply issues, and we'll go to Dr. French and then over to Dr. Ullman.
So hi, I'm Dr. Emma Dean. I'm an assistant professor in the Health Management and Policy Department here at UM. And just actually, as we're recording this, President Trump did sign the bill, so it is official, and I think that hadn't been the case when we started this recording. So just wanted to talk a little bit about the incentives for vaccines and testing that are in the stimulus bill. And essentially, my students always ask, why do we need to put so much funding towards a vaccine? There's clearly a market for it. People are interested in getting it. And there's really two reasons. One is that pandemics are extremely unpredictable. So oftentimes they'll die out or die down on their own. In addition, sometimes they mutate. We know that's the case for the seasonal flu, for instance. So if you're a pharma company investing all the money in R&D, not only when you get your drug to market, which can take years, might there not be a market anymore, but also you might not even be able to test the drug because there has to be a current outbreak for you to be able to test safety and efficacy. So if you're talking about incentives, it's very risky for pharma firms, private firms, to actually invest in R&D for vaccines for a pandemic, even though, of course, there's a clear need. Testing, you have similar issues, and that's why we often see the CDC getting involved, for instance, in developing tests for pandemics. So the bill has funding, and it has two types of funding. So there's something called push funding and pull funding. So push funding, it has the government take on the risk, so to speak, versus the developer of the drug. So in this case, this would be things like early stage funding towards the, the NIH and the CDC to distribute to researchers so they can use those funds to actually put R&D work into developing a vaccine or a test. The other type of funding is called pull funding. So that's making sure there's a market for a product when it comes to market. So in this case, they also put some incentives for pull funding. And this was actually to eliminate patient copays for Medicare Part B. So vaccines are administered through the Part B program of Medicare, which is the outpatient. This is versus the prescription drug, which is Part D. And this is actually an important distinction because for the US minus Puerto Rico, Part B is opt-out, Part D is opt-in. So the vaccines are covered for a large majority of our seniors, who of course are at higher risk for the complications due to coronavirus. So this is important because copays can prevent people from actually getting a vaccine or a drug they might otherwise get, or same as any procedure. Oftentimes there's affordability issues, but also anytime you make something harder for someone, they're less likely to do it. So this is a way to actually incentivize patients to get these drugs, get the vaccine, get the testing, which of course is good from a public health perspective. So that's really what they included in terms of vaccines and testing. Thank you.
Go ahead, Michael.
Okay, thank you. And so I'm Michael French. I'm a professor in the Department of Health Management and Policy, and I'm a health economist. So I'll focus on the business aspects of this CARES Act, which are quite substantial. So as was noted at the beginning, this is unprecedented legislation, $2.2 trillion in stimulus going to all different forms of the economy. So I'll focus on first small businesses and then touch on the larger businesses and how those will be rescued through this stimulus package. So for small businesses, there's $350 billion set aside in the form of loans for small businesses. And interesting element of that is there's a priority given to women-owned businesses, new businesses, and those that are run by individuals that are deemed economically or socially disadvantaged. So trying to give these types of businesses an extra leg up. There's also a provision in these small business loans for them to be forgiven or reduced significantly if the businesses maintain their employees that they currently have on the payroll, as well as maintaining them at the current salary levels. So there's not only are these loans going to be low interest, but there's provisions for forgiving them, which is a key element. And then there's also, related to small businesses, there's a $10 billion set aside for emergency small business grants. These aren't loans, these are really in the form of gifts. And they're administered by the Small Business Administration, which is very active in the small business community, and a lot of trust given to them. And so these small businesses can apply for up to $10,000 per small business. So this is very widespread. We believe small businesses are going to be particularly hurt by the economic slowdown associated with the pandemic. So this is going to be much appreciated by small businesses. So let me turn now to larger businesses. Larger businesses, by definition, are larger, so there's more money set aside for them. There's $500 billion set aside to bail out these larger businesses. This was a controversial provision of the stimulus package because of the fact that they needed oversight of these loans that were being given out and how they would be administered. So take a particular industry that is hard hit by the shutdown of the economy. That would be the airline industry. So they are being given $58 billion in loans for them to try to survive and maintain business operations during the shutdown. Half of those are in loans and half are in grants. And this is to help them to maintain their workforce and also to pay their workers. So the grants are set aside for worker expenses. If they take these grants and the loans, which the airlines are almost certainly going to do, they can't lay off workers at least through the end of September. And then in terms of oversight, this was a key provision that was put in by the Democrats. before it was actually passed by the Senate and then by the House. So this package forbids stock buybacks and issuing of dividends to shareholders for a year after paying off at least one of the loans. And that was something that was very important for many of the senators and congresspeople. And then in terms of oversight, this is going to be done, oversight and accountability, by two bodies, one by an independent inspector general, and then by a congressional oversight committee. And the Congress feels much better about giving out such large loans to larger businesses if there is oversight. And that is something that we learned based upon the way these loans were given out during the Great Recession. So I'll stop there, and I can say more about the economic implications broadly when we get to the end.
Steve?
Hi, I'm Dr. Steve Ullman. I'm a professor of healthcare management and policy. My areas are healthcare economics, healthcare management, healthcare policy, and medical ethics. And so what I'm going to talk to you a little bit about are some of the key elements of the bill that deal with the healthcare organizations, the healthcare institutions, and the insurance arena. I'm going to break it down into 10 parts because these are the 10 major aspects of the bill. And bear with all of us because this is basically hot off the press. And so we're all gaining familiarity as we're sort of looking at the details of this very significant bill. So there are about $100 billion focused specifically on the healthcare industry. Let me go to some of the specifics first. I'm going to go to the big general one that comes up as well. First of all, the specifics. That with respect to Medicare, Medicare Part D, which is the pharmaceutical benefit, and Medicare Advantage plans, the private healthcare plans through Medicare, that the realization is that you don't want the elderly trying to get to the pharmacy every month right now. So there's going to be an extension so there can be 3-month refills and 3-month fills for pharmaceuticals under the bill. Secondly, in terms of some of the rules that are going to be initiated over the next few months, these are going to be delayed till November 30th, December 1st. This includes the following. First of all, the realization is that we have what are called disproportionate share hospitals. Disproportionate share hospitals are hospitals that have a significant number of low-income patients and patients who are tending toward underinsured or uninsured. There was going to be a stoppage in terms of this program starting in May. This now has been postponed till late November, early December, with the realization that disproportionate share hospitals are going to be potentially significantly impacted by the COVID-19, the coronavirus impact. So that program will continue on to a minimum of end of November, early December. The same is true with community health centers, where there is extension of the funding for them through the winter period, with the realization, again, for low-income populations, they're going to be putting a lot of demands on the community health care centers. There's going to be a waiving of what's called site-neutral payment centers. The concept under this was that the government was looking at paying the same amount whether you were having care provided in a high-cost facility or a low-cost facility, that the facility should not make a difference in terms of the provision of care. The realization right now is that there might be patients who are going to be showing up at high-cost facilities, and we do not want to differentiate right now at this point in time between the high-cost and the low-cost facilities. If a person tends to end up at a university-based system as opposed to a community not-for-profit-based system, the differentiation in payment will be continuing for the time being, given the significance of the situation that we're seeing. Similarly, there was going to be a 2% cutback in Medicare payments under the sequester. That is also being delayed right now because the realization is that with the elderly population especially being hard hit by the coronavirus, the concept of cutting back right now in Medicare payments did not seem to sit well in Congress. So that is being postponed as well. Similarly, with the realization that the costs associated with providing care under COVID-19 are significant, Medicare is actually providing a premium, a 20% premium for medical issues associated with COVID-19 in terms of payments. Major insurers have already decided that they are going to be, for the most part, not charging the copay for provision of testing for COVID-19. But there's also the realization that hospitals themselves are now starting to develop their own testing kits. And so with this act now, the insurance companies will be obligated to pay for the testing that is being done and developed by the healthcare systems themselves. Because there's a realization that there's the opportunity for perhaps price gouging for the tests, that those who are producing the tests, providing the tests, must show the cash price of those COVID-19 tests that are being provided to the community. Otherwise, there's a fine to those providers of up to $300 a day. Additionally, the realization is that there will hopefully be immunization at one point, as we heard from Dr. Dean, in terms of the incentives to develop a vaccine, to develop immunization for this. If that immunization comes about, if these vaccinations are developed, this is considered to be preventive services, and there's supposed to be zero price by insurance companies, individual and group and health insurance companies for providing that service. There's also cash flow assistance now. You heard from Dr. French that small businesses are providing essentially business continuity support. That also holds for medical groups. So medical groups with up to 500 employees are going to be covered by that same support system to keep them going during this significant period of time. There's to be also a movement toward more telehealth under Medicare right now, with the realization you want to keep people away from the institutions under the current situation. And finally, the big one, and that's the $100 billion to hospitals. With very few rules attached at this point in time, the Congress wanted to get this bill passed, and they realized if they started putting on a lot of regulations and rules, it would take much longer to get through Congress. But the realization is our hospital industry is going to need a lot of help given what's going on. Elective surgeries have been put on hold, which is a very significant revenue source for hospitals and the hospital system. The realization is that you're going to have people coming in who have no insurance or who are underinsured with very high deductibles associated with their plans, potentially very high co-pays and co-insurance, and where the tests are being, for the most part, covered, with some questioning in terms of what that coverage actually means. The realization is that people still have other aspects. If they're coming through the emergency room, there's emergency room cost in addition to the tests. If people are going to be hospitalized because they are ill, they're going to need basic hospitalization or intensive care unit care or ventilators in terms of helping with their breathing. These are extremely expensive care systems. With the realization that you have 35 million people in the United States without any insurance, and many others with $2,500 deductibles, $6,500 deductibles. People are not going to be able to pay their bills. Who absorbs those bills are the hospital systems as well. And so their costs and their uncollected revenues are going to go up significantly as a result of this. And then hospitals are seeking right now all kinds of equipment, all kinds of personal protection gear, which are very expensive. Prices are being driven up by good old economic supply and demand. And so that's also to support that aspect. So these are some of the major points associated with the healthcare system in and of itself. I'd like to pass it back to Dr. Mortensen.
Last two components that I'm going to address are the stimulus payments that are going to go to individuals themselves, as well as the payments that are going to go to the states. So the Senate bill had proposed that $1,200 in payments would go directly to taxpayers via the Internal Revenue Service. And the Senate bill confirmed, the House bill confirmed that the $1,200 would go to individuals. It's a sliding scale. Once your income goes above $75,000, the payments are reduced, and they cap out an individual's income at $99,000. So there's the anticipation that the average family of 2 adults and 2 kids can get up to $3,400 as a one-time payment at this point coming through the IRS. So that's probably the biggest impact that individuals will initially feel, although there's some concern about how quickly individuals will be able to get that money deposited into their accounts. So if you have filed taxes for 2018 or for 2019, the IRS has your bank information and can make a direct deposit probably over the next several weeks. But if you're a little bit more difficult to track down and there has to be a paper check, that could be through May or potentially even later. So there is some money coming to individuals, but it might take just a little bit of time for that money to come. So again, that's $1,200 for an individual and then $500 per child within that family for people who are income eligible. There's also a major extension for unemployment insurance, unemployment benefits. So individuals even retrospectively will get unemployment benefits with an additional $600 per week included in those benefits. So over a 4-month period, that for many individuals could equal 4 months of their full pay. So the government is doing as much as they can to sort of protect the incomes for individuals. And as Dr. French said, this is trying to encourage companies to furlough these workers and keep them on payroll so that they can jump back on payroll, once the companies are back on track, but enable the employees to get the unemployment benefits while they're furloughed from their company. Major payments to the states. So we have about $150 billion going to the states to sort of help out with their share of medical payments, Medicaid, and other social services. Now, there's a minimum amount for small states like Vermont is guaranteed to get a minimum of at least $1.5 billion. So there's sort of a more equitable distribution of monies going across to the states. There's $14 billion going to the VA, $200 million to the FCC, the Federal Communications Commission, in order to facilitate these rapid improvements in telehealth. The Health and Human Services Secretary has been tasked with developing a new payment rule for federally qualified health centers so they can also start implementing telehealth as quickly as possible. $45 billion going to FEMA, the Federal Emergency Management Program, $12 billion going into housing assistance. People sort of who are on the brink there that might need some additional assistance. So I will stop there and see if anybody has anything that they want to add in the big picture or...
A few comments about kind of the macroeconomic implications, wrapping in some of the things that my colleagues have already pointed out. So one of the issues that was discussed about this is, although it's extremely large, $2.2 trillion, unprecedented in so many different ways, the issue is whether we're going big enough. And the consensus among economists is probably not. And we're going to probably have to pad this again. It's not clear when that would have to occur. One time point is perhaps 4 months, and I'll explain that. So even though this is extremely large and it's going to help individuals, it's going to help small businesses, it's going to help the healthcare community, it's going to help larger businesses, it's really probably not going to fend off a recession. The question is really how deep of a recession. And the good news is that in the US, we have good credit, we can borrow, and we can continue to spend and stimulate the economy. So we're in better condition in the US than, say, Italy would be, which does not have the creditor profile that we have. UK, Germany, they're also able to borrow pretty highly. Just a glimpse of what the possible recession is going to look like. You have to go no further than the claims for unemployment benefits last week, which set a record. 3.3 million Americans filed for unemployment benefits last week. Almost certainly going to be higher in weeks to come. So that's going to definitely tax the system. The other issue is these direct payments to individuals. Well, there's two parts, as Dr. Mortensen said. There's the direct payments, which are going to stimulate the economy right away. and your payments are based upon your income level and the number of members of your household. But then there are expanded unemployment benefits that will occur over 4 months. What happens at the end of those 4 months? The direct payment is going to end. It's a one-time deal. And then also the unemployment benefit expansion is going to end. So that's probably a point where we're going to have to, the Congress is going to have to think about a second stimulus package, if not sooner. And then the last point is related to what Dr. Ullman said, which is, and this is more of a question than a prediction, but because the healthcare industry, not only the providers, but and particularly hospitals among those providers, but also the workforce is being incredibly taxed during this pandemic. I'd love to have a crystal ball to see what that segment of the economy looks like a year from now. There's a lot of guesses on that. We really don't know. I just worry about the fact that they were strained so much during this pandemic and continuing to be strained. I personally worry about what the healthcare industry is going to look like, and particularly hospitals and the workforce. So I'll stop at that.
So absolutely, that last concluding thought you had was something that was just put out in an editorial today on Modern Healthcare, that the impact that this pandemic is having on our frontline physicians, nurses, administrators who are losing colleagues and will have to recover from losing their colleague, and sort of how do you push forward with leading a healthcare system or frontline treating patients when you are grappling with loss within your own organization. Just a couple concluding thoughts. On the day today that the Congress approved this legislation, there were almost 100,000 cases tested positive of COVID-19. We can do a whole separate webinar on access to testing and things like that. And 1,500 deaths in the United States. So we are most likely just on the starting end of this pandemic. So in some ways, it's nice to see that we're getting some stimulus now before things get much worse. Pelosi and the House have promised that there will be more action on this, that this is not enough. Now the Senate has agreed, but they said that they most likely won't convene again until April 20th to sort of pursue what the next steps will be, that are likely to be watching to see what impact this stimulus bill is having, how rapidly these effects trickle down to people who need it most. In terms of the Affordable Care Act, it'll be interesting to see what happens now with the ACA. The Trump administration is considering doing a special open enrollment period right now. So as these individuals are losing their jobs, this is a perfect time. This is sort of was the design of the market exchanges, the insurance exchanges on the Affordable Care Act, was to provide access to insurance at a time of need when you don't have access to employer-sponsored insurance. So if we open up open enrollment in a special period, we can see whether or not the Affordable Care Act is chipping in and helping right when it is supposed to. Other things we should anticipate, we see that treatment is not necessarily completely covered, and hospitals are expected to bear those costs. A lot of the $100 billion going to hospitals right now is more to replace the elective surgeries that Dr. Ullman was talking about. We are concerned still about surprise bills. So if you go in and you get your test and then you're identified later with COVID-19, it's unclear if you don't have insurance how much of that treatment will be covered, whether or not your facility fee, or if the anesthesiologist who was helping you out was in network or out of network. All those things become really complicated. So clearly we're going to have to continue these conversations and keep you informed on what's happening so far in the United States on this COVID-19 pandemic. So thank you all for your time.